Greetings, this is the coronavirus COVID-19 update for 3/13/2020. And looking at the Baidu numbers again, Baidu is a Chinese search engine and they have a site set up for tracking a lot of information about coronavirus. But the problem is the last couple days they haven't been, their deadline, I think, is what they stated a week or so ago, is the deadline for publishing yesterday's numbers was in the morning from 7 a.m. to 10 a.m. They haven't been doing that lately, so these numbers aren't updated, but they're the latest ones I have. Cumulative diagnosis on the bottom left, 81,013, and 64,263 recovered cases with a few cured in there. And existing severe cases, 4,020. Those would be ICU cases, intensive care unit, pneumonias and organ failures and stuff like that. Deaths in China, 3181. Then they keep updating this map. This map was pretty stable for a long time, but now they're taking the cumulative cases and subtracting the cured cases. So that's why you see provinces turning lighter in color from the upper right and swinging around to the left, and then the new one in the front here. So Hubei province is still really dark red, but a lot of the other provinces are turning lighter colors. And this is yesterday's figure. This says 312, not 313, and that's because today's figures have not been approved yet by the National Health Commission, or are not published yet. They're probably not approved yet because the person doing this it keeps pretty much up to date. So this is a graph with 4 pieces of information. New deaths, 7 new deaths in China. Cured in blue is trending downward or kind of level. And suspected cases in gold is trending down, and diagnosed cases 11, but this was for 312, not for 313. 11 is a really, really low number for a country that has 1.3 billion people. There's no other country in the West that has so few new cases. The second graph plots non-Hubei province and Hubei province and the national. So everything's trending downward here because these are new cases. Then this is a graph they added about 5 or 6 days ago to just show how great China is. New cases in the rest of the world, 6,703, and that's not even accurate. That's way low. And China only has 11 new cases, so there's just showing you what's going on in the rest of the world. China gave the world this virus, and now they've got things under control. And if you scroll down the page further, you'll see a list of provinces. You can open up any one of these provinces and see a list of cities. There's no new data in here. And then they have a global map, which is never accurate. We have a better one. Then if you scroll down further, you see hot search topics for today. So Baidu is a search engine, and Chinese people are searching for stories, and sometimes the search terms don't make a whole lot of sense, but the stories will make sense. So I picked out 6 of them to take a look at today. First, upper left, all Champions League, European League football has been canceled. Upper right, global box office loss. This comes from the Hollywood Reporter, and they say that global box office loss may reach billions of dollars. There's already been a couple of movies that have delayed coming out because movie theaters around the world are closing. And on the bottom right, Spain declares an emergency. And we'll talk more about Spain later. And then we have on the left, Greece suspended Olympic flame pass. So this, you see a Japanese girl here wearing a Tokyo 2020 shirt because the Tokyo Olympics are scheduled to start in July, I think. But Japan has permission from the IOC, the International Olympic Committee, to push the games back later in the year, but we don't know what's going to happen there yet. They could have a really big issue with attendance, so they should think about pushing it back. This is really a fiasco. The way athletes train to reach their peak at the games, and then, if there's a delay, it's just, not good. Upper right, Prince Charles crossed hands instead of shaking hands. He got out of a car and went to shake this guy's hand who was offering a hand, and at the last second he put his hands together and said, we're not supposed to be shaking hands because that's the rule in England now. And on the right, this is Qingming Festival, which is otherwise known as grave sweeping, and the grave sweeping festival, which is coming up here in a few days. So this is Chinese national TV announcing that that's been canceled, and this is, it's a big event in China where people go to visit the graves of their ancestors, and you see the cemeteries are just like floral shops. So, and they also do some crazy things like burn little paper cell phones and burn money so their ancestors have smartphones up in heaven. And this is the global tracker that we use because it's the best one out there. You can see from previous videos, we have one shot or one video where there was a bunch of German politicians in a room with their health care administrators, and they had this up in the background on a big flat screen TV while they were talking. So this is done by the Center for Systems Science and Engineering, which is a research institute at Johns Hopkins University. And right now we're showing a number. This is from maybe an hour ago. 145,000 total worldwide cases, 5,400 deaths. And the only thing wrong with this is the bottom right thing, the graph there, which is, I don't know, I wrote to them about this. I used to work at Johns Hopkins for a while at a research institute, but the graph is out of whack. You can see the scale on the left is wrong, and it's not really worth looking at. And the first thing I do is look at the number of cases for China to see how far off our total number is. And we're pretty close today. 81,013 and 80,945 is what Johns Hopkins shows. And then we take a look at the 4 hot spots in the world. And there's other countries moving up the list here. So we might have, a few more. Could be the United States too. But Italy right now is going crazy, 12,462 to 17,600. So that's an increase of over 5,000 cases in one day. And the deaths. Yesterday they had 827. You can see in the map area, that little yellow highlighted square. 827 to 1,266. So these guys are setting records worldwide for, new cases and number of deaths. It's just going crazy. Then Iran could actually have more cases and more deaths than Italy, but nobody really knows what's going on in Iran. Yesterday, I don't know if it was a space administration or somebody looking at, space maps, but they said the burial sites in Iran are so big you can see them from space. South Korea, 7869 to 8064. South Korea is the model that everybody should follow. They let things get out of control really fast due to this big, crazy, Christian sect church, and they've got things under control. Spain, 2,277 to 5,200 cases, a huge increase in Spain. So let's take a look at the stories and try to figure out what these numbers mean, where they came from. So first, we're looking at Italia. So on the upper left, this was, if there's enough room, I'll put a little slide or a picture story on the upper left-hand corner because that's yesterday's news. So yesterday, the big news out of Italy was the travel restrictions, what you're allowed to do, what you're not allowed to do. There's 12 different travel points. Walking around, you can walk your dog. You can't go to your family's house for dinner. And what do we have coming out of today? Almost 15,000 sick. Now, it's gone up to 17,000, 1,266 deaths. So this is craziness going on. And, there's really I've read a couple of articles. And it says the greatest number of cases in Lombardy and 2 other provinces, 250 victims in one day. But they're talking about deaths there, and that's not right. But there's really no explanation for all of this. They're just giving you numbers and saying it's big. There's not a whole lot about what's going on. Pope to bishops, drastic measures are not always good, or sometimes they are. Lower left, Italian nurses. This is an Italian nurse who got on Facebook to show what her face looks like after maybe a couple of shifts of wearing masks. And if you saw a video a couple days ago, the Chinese ladies who were on the front line, their faces are bloody. They've got bandages underneath their masks to keep their faces from bleeding. Italy reports record 250 coronavirus deaths in one day. So that's the news out of Italy. Things are going crazy. Iran, you don't know what's going to happen here. So here's that story from the Washington Post. Coronavirus burial pits so vast they're visible from space. Yesterday and the day before, there was a guy with a video camera going around in Iranian hospitals showing people wrapped up in sheets, dead people, and people lining the halls in body bags. So Iran, the news out of, Tehran, which is just total craziness. Top commanders hold first session on coronavirus, and Trump is not serious about helping us, or he should lift the sanctions. You guys sent your army general into Iraq to lead terrorists to attack the United States embassy, so we killed him, and then you shot down a commercial airliner, and you got sanctions put on you, and the sanctions aren't going to be lifted, If you guys can, they're saying that the sanctions need to be lifted so that they can fight coronavirus. They can build nuclear reactors, but they can't make masks, So, it's crazy, make some damn masks. You don't need the sanctions to be lifted. The reason your country is out of control is your leadership just sucks. They waited way too late to do anything. And they actually encouraged people to go to the hot spot, the town or city of Calm, and for a religious pilgrimage. They came out and said, we don't want to tell people not to go there, even though there's a coronavirus outbreak there. Well, yeah, everybody in the country got sick because they're staying in, little hostels. They're staying, the religious site itself is pretty compact and overcrowded. They're staying at hostels, using the same bathrooms, using the same tables, eating food together. And, it infected, a good part of the country. We'll see how many people it infected. But yeah, they're screaming about lifting sanctions because, a nuclear country cannot make masks and, goggles and stuff like that. That's crazy. Or, hand sanitizer. Iran should make a nuclear hand sanitizer. That'd kill some germs. Okay, upper left here, what are we doing here? We're doing South Korea. Now, South Korea is the model. So from yesterday's news, China and South Korean models seem like the only way to contain COVID-19. And that's true. And, what we see here is things you don't see in the United States. South Korea sees more COVID-19 patients released than new infections. So the numbers are going down. So this country is doing everything right. China's doing a lot of things right now, but they screwed up, many times. Screwed up big time, by not locking down cities and by sending medical people to the front line without protection. 1,700 medical people got infected in the first month, and I think that number's up to 3,000 now. But anyways, things are under control now in China, and they're under control in South Korea too. South Korea is just, they're disinfecting large sections of cities. There's a guy in the middle there with the disinfectant doing an escalator. And on the right, you see drive-through testing, because they started testing in 10,000 people a day as soon as they ramped up their test kits. They don't have the CDC. They have the CDC for South Korea, but they don't have the idiots that we have in the CDC. And then what do we have? U.S. General is fairly certain North Korea has COVID-19 cases. So this is North Korea, but I'm not going to make a separate page for them. So a U.S. General, there's a picture here of a guy walking by in North Korea with a mask on. Now, if that hits North Korea, there's very little hope of anybody in a country surviving. It's just going to be massive infections. And the other three screens are from yesterday, but they're important. So this is what South Korean experts recommend: anti-HIV and anti-malaria drugs. That's what they're using on all their people. And like the first thing said, they have more people being released now than new infections. So their total numbers going down. So they found these two drugs, which actually is one drug called Kaletra. And this is, two medications that the U.S. first gave to China, months ago when the outbreak first started happening. So it's lopinavir and ritonavir. Those are two, drugs that are in this new drug, Kaletra. And this is made by AbbVie Labs, which is a spin-off of Abbott Laboratories. This is an American company. This is a new drug. This is what Americans should be using. Our problem is the fatalities in the United States are all really, really old people, and they're not going to recover as easily. But this is being used very successfully in South Korea. South Korea came out to the world yesterday and said, hey, this is the drugs. These are the drugs that we are using. And in the upper right, you can see, testing in a drive-through. And yesterday we saw a picture of San Francisco, where San Francisco people are driving by in their car and waiting in line and getting tested. So the U.S. is starting to do this stuff. I don't see anybody disinfecting big swaths of cities or, trucks going by the highway with a huge disinfectant gun out the back. But, we could see that. Then what do we have? We have Spain. So Spain, these numbers are up drastically. And again, there's really no explanation for this. Yesterday's news, upper left, a small picture, first 4 towns were quarantined. And then they encouraged people in Madrid, the lower left picture, urged to stay at home. So Spanish Prime Minister, this is news from today, declares a state of alert over coronavirus. What does that mean? So this is a mandatory shutdown, of various areas. The lower right, you can see a person in an outdoor restaurant who is probably putting chairs away because there's no people. But there's no explanation or no geographical information about where all these new people, these new infections came from. 2,277 to 5,372 in Spain. That's more craziness. Then we have Germany and France. It's really hard getting information out of Germany. Upper left, we have news from yesterday in France. Schools close effective on Monday. They, held a big meeting today, the Macron and his staff, about the effect on the workplace, what exactly they're going to do with workplaces. This is kind of surprising. The middle one here, cinemas expected to remain open with reduced capacity screenings. So France isn't shut down yet, and in Germany, I go to these two sites every day. Spiegel is it's a Mirror basically. So that's a publication called The Mirror, one of the biggest in Germany. The other one is Welt, which is The World. So, there's very little news. You see German numbers here, Germany going from 2078 to 3675. I mean, nearly doubling in one day. Never any news about where that is geographically or, who's being affected. Is it all older people or what? The only news coming out of Germany is the rest of the world. So this is really the first time I've seen a couple of things where Germany is featuring a story on Germany. Inside Germany's piecemeal response to coronavirus. Well, this is actually put together by the Spiegel's staff, the newspaper, and I don't know where they got this picture from. But, that's the reason there's news, is the newspaper itself put it out, about the, German government. Instead of, having the German government announce anything, the newspaper put together a story based on things that have happened in the last few weeks with the government. And this one from the world, how coronavirus could change nightlife forever. That's kind of like a, off day article that, you would publish something like that when nothing's happening. Something's happening in Germany. They're just not telling us. Then we have Switzerland, Norway, Sweden, Netherlands, and Denmark. So Norway going from 702 to 996, Switzerland coming from nowhere to 1139, Sweden coming from way down there to 814, Netherlands up to 804, and Denmark from 607 to 804. So there's a lot of countries in Europe being affected now. So the news stories behind that: Switzerland imposes sweeping measures to contain viruses, closing schools, and etc. What else do they have here? Social distancing, restaurants and bars, and they are not closed yet. So Switzerland isn't shutting down anything. They're shutting their borders to people that are not the people that are going to Switzerland and back from other countries, which would likely be Germany. They're still able to get across the border. And then Norway, what's happening in Norway? They're not saying much. But Norway is essentially shut down over 2 weeks, and that means roadblocks and other cities shut down, no driving back and forth and stuff like that. The population of Norway is all along the the ocean, basically. It's a big rock with big mountains, so most people live along the coast. And what do we have here? We have Sweden. Not much in the way of news out of Sweden. Urge Swedes not to travel unless absolutely necessary. Just generic news. I don't see anything of much value. Dutch universities close. They're telling universities to start thinking of ways to, teach, and they're closing all auditoriums like this one. Denmark closes its border for 4 weeks. If you're not Danish, you won't be able to enter the country. So again, that's Denmark basically borders Germany. That's all. Then the US of A for 313. So cases up from 1,663 to 2,176. I refreshed this screen and took another picture more recently than any other screens in this presentation. Deaths up from 40 to 47. So let's look at the news behind this. So the news from yesterday, America's shameful, slow coronavirus testing threatens all of us. There's been so much about the testing. These idiots at the CDC, just never did have their stuff together. They're just totally, they're just crack smoking imbeciles. That's the only way to think of it. I spent enough, time federal government consulting. I've never seen any broken organization like this before. Just total idiots. These people ought to really be put in jail, and I hope they get sued. Trump declares national emergency. Schools close in 12 states. Cruise lines are halted. And this declaration of an emergency, I think the number is $5 billion. It frees up $5 billion to be used in an emergency. Then on the lower right, this is a good development here. The FDA is starting to get a little bit more flexible. This happened maybe a week ago, where they actually gave the approval for some labs to develop some test kits. This and also some drugs, and the problem in the United States, there are so many research institutes and at hospitals and at universities. And, the research institutes at universities are usually funded by the university by tuitions and by donations and stuff like that. At hospitals, they're usually funded by the AMA, American Medical Association. And then there's, a zillion private labs in the United States. And they kind of have their hands tied because of FDA. FDA would never approve for them to do anything. So the way they kind of got around that was, maybe 5 days ago or 6 days ago, the CDC actually took their test kit, which was approved, and there was actually 3 parts to that test kit, and the last one failed. So the CDC not only came out with test kits way, way too late, and we were doing, like a few tests a day compared to South Korea doing 10,000 a day, but the test kit didn't work. So they had to, make another test kit and recall those. So what happened was the CDC started working with a couple of these private labs, and they actually said, hey, you could just redo the 3rd part, and that way you could get around these FDA regulations because it's a CDC test. So now the FDA has relaxed its regulations for New York State Department of Health. This comes out of the FDA, and I don't know why the focus of this article is on the New York State Department of Health, because they're not that significant across the country. There's other departments of health that are a lot better. But anyways, they gave authorization to start doing some diagnostic testing and developing some drugs. So that's a good sign. That's a real good development. Then what else do we have? Washington reports 5 new deaths. And if you look at the bottom here, this is really crazy. Oh no, it's the bottom on the right. Sorry. 37 deaths among 568 cases in Washington. And on the bottom, they say 5 deaths were reported in King County. Of the 37 deaths reported, 25 are in that Life Care Center of Kirkland, that senior assisted living home. So a lot of deaths coming out of there. 25 deaths out of one, senior citizen living place. And we expect that case to double every 5 to 7 days. That's just craziness. This is, somehow this entire facility just got super infected with coronavirus. I don't know if they've ever, moved patients out of the room and sprayed everything down. They should be taking some measures here to, to try to save some people. But, they expect that number to double every 5 to 7 days. That's crazy. And then this last thing is my graph, because I don't see anybody else making a graph of the United States. So you can see what happens here, on the lower left. Back on 2/21, we only had 16 cases. And then around 3/2, that went over 100. And then it started curving upward, accelerating the number of new cases. You would call that not quite an exponential curve, but it would be a geometric curve as opposed to a linear, straight arithmetic curve. And then it started curving up from 547 to 607 to 971, and now it looks like it's trending up again, accelerating again from 971 to 2176 today. So that's kind of curving upward again. Not something we want to see. Okay, that's all the news. Now I have a couple other videos I'm working on. One focuses on the CDC and not just on the testing. Everybody has the Washington, was it the Washington Post? I think did a really, really good article on the testing of the CDC. So I put that in my presentation. I didn't have to look all that stuff up again. But it basically takes a look at what else the CDC is doing wrong other than testing. So I'll have that video published pretty soon. That's all I have today. Appreciate your time.